stuff back up and rolling.
Tonight, we're going to be talking to Dr. Blodgett. The other night, we tried to do a recording and somehow it didn't quite take. So we are asking for take 2.5. Kelly, will you take it away?
Absolutely. Thank you. Thank you for having me back on. It's always great to see you. I'm going to work on getting my screen shared here. I'm just becoming a tech dude, you know, as normally I've got, you know, we've got a team member at the office who's like our rock star of tech, you know, and I'm just barely figuring this out. So great. Here we go. Yes, Kelly Blodgett here, coming to you from Portland, Oregon, where we're having a beautifully sunny day, just like we always do in April. Sarcasm intended. Yeah, tonight my intention is to talk about really one of my favorite things about holistic and integrated biological dental medicine, which is the issue of root canaled teeth. I'll share some of my experiences with root canals and the conclusion that I have come to. And I think it'll also be worthwhile to talk about where I do feel that endodontic therapies can serve a purpose, but it's certainly not to the extent that our profession takes, you know, on a day-to-day basis to the tune of thousands of them. So I will share a little bit about my educational background that I got my bachelor's degree in psychology back in the early 90s. And originally my intention was to go into the field of counseling when I was then drawn to oral health. But I feel like one of my greatest strengths as a practitioner and also as a business owner and a coach and mentor to those who are in my practice is like the skills that I learned in terms of communication and connecting with other human beings, because that's really what we do. And I'll share this image here that kind of embodies how we operate in our practice. I really believe in the saying that, you know, people don't care what you know until they know how much you care. And all of the systems in our practice, whether it's how we create the verbiage and the aesthetic of our website, to how people are received on the phone when they call, to how we have a totally different space for our new patients to meet with our hygienist when they first come in, that has nothing to do with dental operatories. It's just its own kind of living room space. It's also that we can let them know that this is about you as a human being, and we want to know, or want for you to know how much we care about you. So we go from kind of knowing their heart to knowing their mind. So we ask a lot of questions. I drive my practice by wanting to understand, what are your goals, right? And a lot of times people have never thought about that. I would say by and large, most people's experience in healthcare and probably in other areas of their life is that we're often told what we should do or what you need to do. And those are words that I've coached my team members not to use. So we don't say you need a crown, you need a root canal, you need an implant, you need a whatever. You know, I jokingly will say on a daily basis, people don't need teeth, right? We have patients who have no teeth and they're satisfied with their denture. So, you know, we're more about wanting to gain an understanding of what are your goals? You know, what would success for your oral health look like for you? So, you know, we get through their mind, and then the last thing that we do is, okay, well then let's go ahead and, you know, consider your oral health conditions and the more the objective kind of stuff. So I thought I'd share the story of how the root canal thing in particular came to my high level of awareness. And I might start the story by saying, root canals were never one of my favorite things to do. I can still recall back in dental school when they recommended, like, you know, hey, be smart, Start with an easy tooth, get a single canal tooth and start there. Well, that wasn't the way the cookie crumbled for me. I'll never forget it. It was number 2 on a guy, with big cheeks and a big tongue. And poor guy, it was like 3 3-hour appointments just to get this one root canal done, all by hand, the stainless steel files. This is before the days of the rotary instruments that are just, commonplace today. Some of you can, probably are familiar with that level of discomfort. Anyway, I got to where I was providing that service as a resident at the Veterans Hospital here in Portland. We had no endodontic residents, so we did all the endodontic therapy there. And I will say, early on in my career, I took a lot of endodontic CE because, it just seemed like a good thing to know how to do safely and well. But even in the best of conditions, I found there to be challenges. It was less than predictable, I would say, that we would have. Sometimes people felt great afterwards, and sometimes they would be left with, kind of a nagging problem with it that they couldn't really put words to. And, I was trained to believe like, hey, once you do a root canal, it's fine. And we were using microscopes. I've owned the same microscope since 2003. I've been using lasers in my endodontic therapy since 2004. But, there's no panacea, right? Sometimes it doesn't work well. And it took me, a good more than a decade for it to really dawn on me how odd it is that we kill body parts and leave them in bone and expect that the body's going to be okay with that. So about 7 years ago, my father came back into my care. He had been seeing my brother for a while, and then my brother moved to Texas. So my dad came over to me, and we started, we did a cone beam scan. And interestingly enough, he had had root canal therapy on teeth 14, 15, 18, and 19. So all of his molars on the left side. And the abscess condition of particularly 14 and 15, but also 18 and 19 as well, was severe. And, I'll never forget having that conversation with Dad about, hey, Dad, here's what's going on. You can see what I see. All this infection is draining down through your lymph system. He didn't have any, buccal fistula or anything like that. It was just going down the lymph nodes. And of course he said, well, it doesn't hurt, right? And I think that's an excellent point. And I can appreciate why after people have invested time and money in doing root canal therapy, if it doesn't hurt, it's like, well, hey, what's the problem? So we agreed to come back to it. He wanted to think about what I had shared with him. And then, unfortunately, within that next year, he noticed lumps in his neck and went, he didn't bother to call me because he's thinking it's my neck. It's, what's that got to do with my teeth? So he went to see his oncologist, or actually he saw his physician first, who referred him to the oncologist. And he calls me up. This is like Thanksgiving, right before Thanksgiving 7 years ago. And, he tells me, well, I've been diagnosed with non-Hodgkin's lymphoma of my left cervical chain. And I said, remember those dead teeth in your jawbone that have the abscesses? I would not be surprised if those are, what's driving this process. So he was kind enough to give me the name of his oncologist. I took some slices of his cone beam scan and sent it to the oncologist via email. And this started a great conversation about causation. And it was wonderful that his oncologist was so behind the idea of getting these teeth out, clearing up that infection so that he wouldn't have a recurrence. And it's, I've seen this happen a number of times with other patients where, unfortunately, that they go see an oncologist and they start into chemo and or radiation, and there's never a dental referral, or at least rarely. And so part of what I feel my mission is, and I imagine I share this with many a member of the IABDM, is, we want to be conduits of information and connecting dots for people. Because if you're doing systemic treatments but not treating the cause, that's not going to do them a lot of good. So anyway, thankfully my dad's doing very well now. It did inspire him. He had 3 other teeth that were root canaled, which over the last, probably 2 to 3 years, we went through a process of removing those, getting him provisionalized, getting him into some permanent ceramic restorations, which is pretty cool to see your dad. I mean, you can see my dad's got his smile going on there. This is the first time in his life he smiled like real smiles, because he hated his smile before. So it's been a real blessing. I love it when he smiles now. He even says, like, I'm shocked at how much I smile. I love doing it now. So that's fun stuff. Great. But just love that he's got all the infection out. So interestingly enough, around that time, I got turned on to this book, Whole Body Dentistry. My wife was doing some work with a company called Beauty Counter that where they're all about safe beauty products, minimizing toxic exposure, things like that. And somehow in my research of looking into what she was doing, I came across this book and read it. I remember it vividly. It was spring break 7 years ago. And I just loved it. It's written so well. You don't have to be a dental person to appreciate what Dr. Briner shares in that book. And it kind of lit a fire for me, re-inspired my learning. And it was interesting because at that time, my practice was also going through a total revision. Matter of fact, it was right around Christmas of 2012 where we were kind of peeling out of the rough economy. And I'll never forget, I only had 3 employees at the time, and 2 of them quit the week before Christmas. So I had 1 employee. And from there, we've rebuilt over the last 7+ years. Now we have a team of 12 people who are completely, their heart is totally into whole health dentistry, which is awesome. But anyway, they've all read these books. I read Whole Body Dentistry. I got turned on to Root Canal Cover-Up. Great book. I find it fascinating that one of the founding members of the American Academy of Endodontists writes a book as he's retiring, sharing like, I found all this science that goes way back that indicates why, people deal with all these systemic infections. It turns out killing teeth and leaving them in your body isn't so good. And then that led me to books like Toxic Tooth and some other books that Dr. Levy's written. If people haven't come across Dr. Simon Yu's books, Accidental Cure was his first one, and Accidental Blow Up in Medicine was the second book. Both phenomenal books. He's a great physician out in St. Louis, Missouri. But anyways, those are worth a read as well. And the more I read, the more I see that there are not so much dentists. There are dentists who get this, but the number of physicians who are seeing the connections is very promising for me. So anyway, I've been reading all that. That led me down this path to joining the American College for Integrative Medicine and Dentistry. This was, I guess I started June of 2018. It was an 18-month program. And my lead hygienist and I did this together. I was the only person actually to bring a team member, which I thought was interesting, but we learned a ton and had an absolute blast going out to New Jersey a few times. But, we got to really dig deeper into things like homeopathy, acupuncture, spiritual medicine, nutrition, gut health, all sorts of stuff. And then we bring it back, and we've shared different books with our team members, and we've done like book clubs and stuff, which our team members have really appreciated. So it's, in doing so, it kind of has built the culture. So I found that if we want to make changes in dentistry or in any realm, you really have to, drug companies understand this. You have to go to the public. And it drives me nuts when I'm watching TV and it's like, oh, it's another commercial for a pill. It's another commercial for a pill. It almost, to me, it seems somewhat unethical, but they're creating awareness so that lay people can go into their physicians and say, hey, I heard about this. Yes, I understand that there are all these potential risks like dying, but is this pill appropriate for me? Well, nobody does that in dentistry. We have this very odd culture of like, oh, let's not rock the boat. Why else would people still be putting mercury in human beings' heads, right? Oh, it's the hardest stuff out there. It works great. It's been around for years. It's like, this is insane. There's so much science that supports why we shouldn't do that and how unhealthy it is for people. But nobody wants to rock the boat. And I feel like that's part of my mission in oral health care, is to create awareness. And it turns out that as much as people are on, digital devices these days, particularly smartphones, like Instagram and Facebook have become these wonderful platforms to be able to share information. And two of the things that I try to incorporate when I'm communicating on those platforms, one would be objective scientific data that supports the point that I'm trying to make, as well as sharing the subjective story that the patient shares with us. So when they come in and say, gosh, I had this root canal done 6 years ago, and shortly thereafter started having problems with my thyroid, and we take we take out their tooth, and within a year their thyroid goes back to normal functioning. Like, if that's what their story is, and that, it's corroborated by the scientific evidence of working with their physicians, that's pretty hard to deny. So we try to share those stories. We gather a lot of information for all of our patients so that we can communicate these messages effectively. So, and I have to be honest, I absolutely underappreciated the power of social media. I don't by any means think that I'm over the hill, but I was one of the Atari 1600 guys with a joystick. I can't even figure out how my girls use, the Wii or Xbox stuff that we have now. It's all a bit beyond me. And really my only exposure to Facebook was like my 20th and my 30th high school reunions. And, Instagram, I'd only been exposed from what I saw my girls using it, doing like selfies and stuff. So I didn't really appreciate how that would help me reach other human beings as it pertains to their oral health. But one of our patients who owns some birthing clinics kind of challenged me to look into it, because I was telling her like, I just don't see how that's appropriate for us. And her comment to me, which I'll never forget, was, are you telling me you don't want new patients? And I thought, well, wait a minute. What do you mean here? Maybe I'm missing something. So anyway, I took the leap of faith and started telling a story, a story about a patient's health who had gone to their dentist repeatedly and shared how they were having challenges with their systemic health, and they just didn't buy into it. Right? It's just not part of the what we're taught, right? That you can kill teeth and it's supposed to be just fine. And she knew in her core that something wasn't right. And I still recall the first phone call that we received where a new patient was asking, would we take out teeth that had been root canaled, because she knew that something was wrong with them. So if you recall, I talked about connecting with a person's heart first. it is so critical to acknowledge that every person's truth is, it's right on the money for them. I mean, I can't tell them they're not feeling that when they've had root canals. And if they can add up that after having the root canal therapy, that their health turned for the worse, I'm willing to acknowledge it. And certainly, I'm had a lot of training in oral surgery. If they want dead teeth out of their head, then I figured, I'm here to help you do that safely and well. So certainly we did. And her turnaround in overall health was shocking. I mean, it was one of those moments where the whole team had an aha when she came back for her post-operative check and suture removal. It was just mind-blowing. And this was even before we were doing LPRF grafting and stuff. But it was like, I think we might have come on to something here, right? So we started sharing these stories via Instagram, and lo and behold, turns out there are a lot of people out there who also feel similarly and have this gut sense that like, something's not right. I mean, how many people do we see who are dealing with these quote unquote, mystery illnesses, right? Where we'll give them this name or that name. We don't really know. But if we're not looking at the oral health, which of course most people who go to see a physician aren't being asked. So, do you see a dentist, and to what extent do they help you manage your care? There's no awareness. So this stuff that we're putting out there is apparently seeming to resonate with somebody. And I want to add that when we started doing these posts, I think we had, if we had 200 followers on Instagram, that would have been a lot, right? And currently, I mean, it's been just over a year that we've been sharing stories on Instagram, and we're just rounding 15,000 now. So I think like we've definitely done well just doing the slow grow, but maintaining a consistent connection with people. So it seemed to be working well. And so we continued to share these stories. And partly what I found interesting is that, not only is it so nasty, I mean, I have to admit, when I share these photos, partly it's the grossness of it that's so like, oh man, really? Like all that blackness is in somebody's mouth. And I hear those comments from people that like, oh God, it's like watching a car wreck, like I don't want to look at it, but I can tell that, I have to admit, I find it interesting. But, I've heard people come up with a lot of different reasons why these teeth might be dark inside. All I know is that when we send these out for DNA analysis, and we use DNA connections for those reports, that it's, there's always stuff in there. So, we add that on because if I were to just show the photo and not the corroborating scientific information, probably wouldn't be quite as interesting. So it kind of validates, right? Hard to argue with the DNA science. Yeah. Yeah. Oh, I see. Sorry. So back on track here. And here we have another one. So we got, I don't know, maybe 3 to 4 posts into this. And it just by dumb luck, honestly, we were doing them on Tuesdays, and my marketing person gave it the name of Toxic Tuesday because she couldn't believe, she's not a dentist. She couldn't believe the stuff that I was sending her to load into Instagram and stuff, how gross that was. So she decided to call it Toxic Tuesday. And it certainly is. So one of the questions I get or was getting at that time frequently was like, well, how is this, right? And one of the things I remember learning back in my days of psychology was how the vast majority of people learn visually. So I figure, well, this is a visual medium. Let's utilize it and try to educate people in terms of, education. So here we see like a tooth, and I'm giving like, different iterations of how you might get bacteria into a tooth and why it might die. And then the picture on the right shows like, and this is what your root surface looks like on a microscopic level, right? When we explain to people that the roots of your teeth are porous like a sponge, it doesn't, it doesn't make sense at first, because what they're appreciating is the hardness of it. But when they see these images and the bacteria that are, clearly are a heck of a lot smaller than the tubules, they can easily appreciate how, like, oh yeah, I would imagine if your body no longer had any defense mechanism, how those bacteria would infiltrate the whole canal system, which they do. I've sent out dozens and dozens of teeth for analyses. I've never once seen one come back that wasn't teeming with gunk. And I will say, and maybe we can address this in a future Zoom meeting, where I can share my specific protocol for removing teeth. I remove the clinical crown of every tooth that I take out. Partly because if I'm sending it in for analysis, I don't want information of decay or something that's in the coronal aspect of the tooth to mess with what I'm measuring that is subgingival. So I only send stuff that's subgingival to the lab, just to verify. So here we go, more nasty stuff. I love that image on the left side. Like, can you imagine, right? Green, mucusy gunk coming out on the root tip. Of course, they perforated through the sinus. And as you can see on the fourth image there, literally, the bone has just melted away with that sinus infection around there. It's just nasty. So, and again, these are stories that people resonate with. So here's yet another. This is Colin. I will share a little interesting thing, and then we'll watch a video that Colin made. He is a videographer and filmmaker, and he was in shooting some film. We were doing some work with a very Instagram savvy and popular physician, Dr. Jessica Petros. She was in and allowed us to film her experience because of, she was just blown away with how we were able to help she and her boyfriend with their oral health stuff. And as we were filming, Colin started recognizing, like, hey, I had this problem with the tooth and I think I should get in here. And so anyways, he ends up telling us a story about a knee infection that flared up, severe pain. He couldn't walk, went to the physician. They could not figure out for the life of them, like, what was wrong with his knee. And when he comes in, we see like this upper first molar, tooth number 3, which is on, if you look at the middle image there, it's on the right knee meridian, severe infection. And that's his tooth on the left side that you see, like, all that blackness, just so gross. But I'll go ahead and share his video because I think he'll share his experience and the impact that this had on him. And I really feel like this type of engaging video is so important to help connect with other human beings, because here's this human being telling them, this was my experience. This is how I got better. I'm blown away at this and how appreciative I am, yada, yada. So we'll just take a watch on that.
My right knee had this massive infection 6 months ago, and I had no idea what the cause of it was.
I'm in a wheelchair right now.
Going into the doctor, your knee's swollen up and you can't really walk. Well, there's no explanation. Tell me what's going on in my knee. But they couldn't. I have a tooth up here, totally infected. Came across this holistic dentist named Blodgett, and I get it looked at. Yeah, this root canal tooth that's infected, that's leaking infection into your sinuses, that tooth with your meridian chart is connected to your right knee. And my mind just was like, as a kid, the values of dental health were instilled on me. There was no education given to me around why I was getting root canals. It was just like, oh, your tooth is hurting. Let's just cut out all the bad stuff and just fill it up.
All this dark gray around there is the infection that's come through the root canal tooth and gotten into your bone.
The crazy thing is that there's no other place in life that you have a dead body part lingering in your system.
Your body has been experiencing the systemic effects of having that infection.
We sat down in the chair, And he went over, here are the possibilities for what we can do with your mouth.
We have to get down to healthy bone structure.
So today we're taking out 2 teeth. They're going to go in with lasers. They're going to use some ozone.
Your white blood cells and your clotting factors. You put that back into the extraction site, and your body knows how to convert its own cell into fresh bone, healthy tissue.
It's a step in the right direction towards a more holistic way of changing my lifestyle and changing kind of the way that I take care of my overall body and my systemic health. And that's something that Kelly and his team has opened up my eyes to, the possibilities that are offered when you're actually excited about the treatments that you're getting. The aspect of just having that kind of family supporting you in your dental journey, in your holistic kind of health journey, that to me is a huge win here at Blodgett. My name is Colin Spalka. I am a patient of Blodgett Dental.
Great guy. Wonderful story. You know, it's pretty powerful. I think that like that was a huge life aha for him. Very interesting too. His mother happens to be a physician at the Mayo Clinic, and he's a bright guy. I mean, really a bright guy, and he totally got it. And it's just a real, you know, huge blessing that he was able to put that together. He's done another video for us, and it's lovely, right? Because people get that, it resonates with them. So, you know, I was having so much success connecting with other human beings about dead teeth that we decided to talk more about mercury fillings, both as we can see in these images. We're talking more about the structural integrity issues that occur when you chop a tooth to bits. I love the one on the right. You know, I remember telling the gal in 2005, you've got fractures. You know, she comes back 2007, 2007, one cusp broken off. Well, it doesn't hurt, you know. She comes back a year later, another cusp broken off. It's like, oh my gosh, at what point are we going to deal with this stuff, right? But this is the way it goes. You know, unfortunately, that whole extension for prevention modality that we learned in dental school, it costs people their teeth in the long run due to all the structural integrity damage that's done. And then we've certainly shared on other posts the metallurgical toxic exposure issues of having metals like mercury in your mouth and the vapor. Matter of fact, I was just reading the ADA's website this week for the post that I wrote, which had to do with electromagnetic frequencies and cell phone usage and Wi-Fi towers and wireless home phones, and how that energy has been shown to increase by more than double the vapor. But it's interesting to see on the ADA's website, they now acknowledge that in fact, vapor does constantly come off. They're just off the fillings. They're just not willing to admit that that has systemic effects, unless of course you're a child 6 or younger or a pregnant woman. But you know, I mean, that's insanity as far as I'm concerned. But this is why we need to educate people, right? So interestingly enough here, we did one on fluoride. I haven't done a lot on fluoride just because if I'm being honest, it's because I'm so blown away with the root canal stuff that I'm taking out on a daily basis that's more the focus of my attention. But interesting to look at like how many people liked and how many people responded to this post. Clearly there are people out there that are highly interested in having a lifestyle that is, you know, free from fluoride exposure. So, you know, why not? I mean, you know, if your saliva is healthy, your mouth's going to be healthy. You don't need the fluoride. So, and this is one of my favorites as well. You know, this tooth came out and the root was so nasty. You know, I mean, look at how dark that is. I was like, okay, we need to find a gangrenous toe here to I mean, this is what it looks like, right? I mean, that's a dead root. And look at all the bacteria and other stuff that were in those 3 roots. Incredible. And then you can see on that slice from the cone beam that in fact, you know, that periapical region is creating sinus irritation and problems. So people get this, right? This makes absolute sense. Another one, this is a great tooth. Just so happened as we were elevating those roots out that they split right down the center. So we're able to see all of the darkness that was adjacent to that gutta percha cone that had just been leaking from underneath the crown and through the dental tubules and all that stuff. I mean, look at that image on the cone beam, right? Like that is, what's also interesting, I think, because most of the people who are going to watch this probably are in the dental profession. When we start looking at these cone beams, it's very obvious to see the darkness around the tip of the root. But what I also think is so interesting is when we look at the increased radio opacity around those areas, it just speaks to how incredible our bodies are, that they're trying to wall that stuff off, right? It's just incredible. And then recently, I mean, why not? Everybody else is talking about, COVID-19. I put up a post to say, what is worse, right? The flu virus of the year, which granted, it's pretty toxic and it can take a toll on people if you have other health issues that put you at risk. Not so much if you're generally healthy, but trying to make the point that, in America, more than 15 million root canals are done every year. And what you see on the right in terms of the amount of chronic infection that's going into your lymph system and ultimately your cardiovascular system, how are we not concerned about this? And again, it'd be one thing if it were a handful of teeth, like, oh yeah, it's a risk, every once in a while, it seems like every tooth I take out. And many of which, by the way, are asymptomatic. They're simply people that, feel both in their gut and because they have, connected health symptoms systemically, that they want these teeth out. So it's pretty powerful stuff. And again, here it's just kind of showing toxic exposure issues. In this case, we're talking about cavitations, that's probably the other thing that I spend so much time doing clinically is root canal removal and cavitational lesion treatment. And just using some supportive information here from like the WHO, International Association of Dental Research, for those people that like the sciencey stuff. So I thought I would go ahead and, I know that we're recording this for future use, but for those who are watching currently, if you had any questions or thoughts or something we could connect on before we wrap up for today, I'd be happy to field that.
Well, we do have questions on here. I'm going to let the one person that typed this in go ahead and ask her question directly to you.
So basically, I said, have you noticed that many of the people who have had root canals tell you that they've been feeling depressed for a long time, since shortly after the root canals were done, and then after the root canal was removed, their depression went away. They felt lighter. They felt they felt like just things started going right for a change. It's just, they're like, oh my gosh, my spirit lifted. I feel lighter. I feel like I can breathe again. They talk about when they have their root canal in their head, right? They feel like this heaviness that's just coming down on them. And then when you remove it, that's what I've noticed. And that's not on the tooth meridian chart.
Yeah.
No,
well,
that's not on it, but that's what I've noticed. And it doesn't matter which tooth it is. It's like they can feel something just bogging them down.
Yeah. What I think from an energetic standpoint, and I agree with you. I mean, I've been mind blown, especially the instances where you're elevating a tooth out, the patient's totally numb. They have no way of knowing exactly when that tooth actually disengages from the bone, but they know, right? It's like instantly. And I wouldn't say it's every patient, but I would say that quite a few have that experience of like, whoa, what just happened? And I'm like, what do you mean? Just what, like your tooth just came out, and they're like, I feel different. And it is one of those, like
I had
Wow.
the same thing happen when I removed the last speck of the last amalgam.
Mm.
Like I will have removed, like we've been, removing amalgams or whatever, and then we finally get their last one, the last tiny speck. And I've had a patient tell me that same thing, that they all of a sudden, it was like they always had a buzzing in their head,
Yeah.
and it finally went away, like tinnitus, and it just finally went away. And they're like, it was boom, instant, and
Absolutely.
who am I to argue with that?
Kelly, can you describe to people what cellular memory is?
Cellular memory. Well, I mean, I was kind of thinking more along the lines of just the energetic sphere. Again, I have to think in terms of like visuals, because that's how my brain works.
I'm talking about like when a tooth is removed and the person remembers how that tooth was damaged, and they're reliving the moment of the trauma of having that root canal done in the first place.
Oh, I don't know that I'm totally familiar. Tell me more about what you mean so I can.
Okay, well, there have been instances where I have been involved in a surgery where once the tooth is out, the person starts crying and they can remember what somebody was wearing and the trauma of their mother being there while they were drugged to the dentist office because it was a
Right.
traumatic injury.
Right. Yeah, no, yeah, absolutely. It's interesting. So I work with an anesthesiologist where it's not a daily occurrence, but we work with him a fair amount. And it's interesting because a lot of the folks that I see, if it's more than a tooth, like, let's say we're addressing multiple things in one visit, I oftentimes, depending on their subjective or affective demeanor, will ask them like, how do you feel? What would you feel about like sleeping through this process? Because they've been so traumatized. And so many of these folks, I mean, goodness gracious, if they have multiple root canals, crowns, whatever, it's like, well, those didn't happen usually all at once, It was one at a time. Every one of them's usually a challenging experience. Even in the best of situations, it's energetically draining. So I would say we do work a fair amount with him to try to kind of avoid as much of that as we can. But at the same time, I mean, I've had people during the times of, during anesthesia who become emotional just because of what it means to them to be losing a tooth. And I think
Body
that's,
part.
yeah, absolutely. I mean, it is loss. And I think it's good to recognize that my team is really connected, I would say, with that concept that there's a huge emotional component. One of my hygienists in particular, when she first started working for me 7 years ago, she had I think both of her upper second premolars had root canals and PFM crowns. And since then, they've been removed, we've grafted it, she's healed, we put in implants and they're restored. But she really connects with like, wow, that was a very significant emotional experience to lose teeth, even though she knew it was dead before, right?
Right.
It's like it wasn't really connected, but there was a periodontal ligament connection, of course. But it was that sense of loss,
So we have another question on here. It says, it's twofold. Have you ever seen a sterile root canal on one that you've sent off? And number two, do you require a DNA connections on every patient, seeing as that would add to the cost?
Right. Great question. So the first part, have I ever seen one that was free from bacteria? The answer is no. Never. And I have actually been doing a study with DNA connections because I'm an absolute geek. I mean, like it dawned on me one day that like I wasn't exactly sure of how they tested them. So I called up and talked to Leslie Douglas there, their chief scientist. And I was like, explain to me how you do this, right? So then I posed the question of, well, what if we used a Comet, a dentin grinder, and ground up, like in a two rooted molar, what if we ground up one and sent the ground parts in one tube and then the whole root in another tube, and we tested those, right? So like, I find this stuff highly interesting. But I mean, I don't know if it's quite 100 roots yet, but we're getting close. I do not require that people do that. But a lot of our patients choose to. Usually the question that I get from patients that I think is 100% valid is like, well, how will the information that you find modify the treatment that we're doing today as we're removing the root? And I tell them, well, you know, in all reality, it's not. However, I have found for some patients, and this is not, it's not frequent, but it has happened where they're working with either a naturopath or a physician or an osteopath, whatever, where they want to know what was in it because they're considering some antibiotic therapies. And in those cases, it has been helpful to have it. But I've yet to see one come back that wasn't teeming with stuff, you know? And these have been even clean teeth. As a matter of fact, I mean, I share a brief story. I know my wife won't mind. She had been seeing a naturopath for some time. She had by the way, number 6, her upper right canine, had a root canal 30 years ago, right? She was just starting college. And it looked fine on a PA. And the interesting thing is that it happens to be on the energy meridian of the liver. And she started seeing a new naturopath who was saying, oh, this is so interesting, as she was reviewing her old blood work, that your liver enzymes continue to elevate. And I don't understand why. I mean, she is, you know, in great shape. She eats beautifully, like she does everything right, but something was off with the liver. And as we started doing a little research, like, well, wait a minute now, your tooth is, you know, on that energy meridian. We ended up taking it out, sending it in. And I mean, I don't know anybody who has is fastidious of oral health care and hygiene as my wife. And sure enough, there's bacteria in this stinking root, you know? So it just doesn't matter how clean you keep it. I mean, to some extent it does, of course, but it's
And Kelly, can you explain, this is not normal bacteria that you would just find in the mouth on someone if you extracted a healthy tooth and sent it in. This is
right.
more like, it's amazing how many times Borrelia shows up.
Yeah. Well,
and people who are listening, let's make sure that they understand this is not normal bacteria that you would find. This is, for the most part, pathological.
Well, and I would agree. And I think that what really needs to drive home is roots that are, I mean, your roots are in your jaw bone. Your bone is designed not to have bacteria in it. And that's exactly what happens when we remove the vital blood supply, lymph drainage, and nerves within teeth, is that it becomes a sponge that wicks bacteria into the root system and then into the lymphatics. And I mean, on top of that, it becomes a energetic resistor in that energy flow process, you know, and none of that's normal. None of that is biologically sound.
Dawn makes when she teaches the whole thing about how we are electrical beings, right? And,
right.
And the problem is that when they teach gross anatomy in schools, obviously all of the patients are dead. And so people are like, well, I've never seen a meridian at work. And Dawn's like, well, of course you don't, you know, of course you haven't, you know, the patient's dead, you know, when you're cutting them up. If you want to see a meridian at work, you've got to watch a live patient. They've got to be able to have an EKG that shows they're alive.
Yeah, absolutely.
You
know? Absolutely.
So would you be willing to come at another time and really show us, if you have some video about step by step on removing a tooth? I know a lot of people do it differently. Some people do the wiggle and then they let the tooth sit for a little while and then they come back and remove it. If you would do that, I'd be happy to set up a time for you?
Absolutely. Absolutely.
That'd be
Matter of
great.
fact, Colin, whose story we shared, as a nicety to me, he recorded all the steps that I do. When I graduated from the American College of Integrative Medicine Dentistry, we all had to do an hour-long presentation about something you're excited about in health, whatever it was. And mine happened to be about extracting root canal teeth and setting it up for healing. So I have video of all that stuff, which should, yeah, now that I know we can do video on here easily, that'd be great. Be happy to do that.
Okay, does anybody else have any other questions for tonight? If not, I will get this recorded so that we can get it up tomorrow for people to see.
Thank you so much, Kelly. And again,
Thank
I
you,
apologize
Kelly.
for the hackers.
Yeah.
But we're so glad that you still were able to go through, and it was a
It
wonderful.
was a great presentation. Thank
yes,
you.
very, very good presentation. I love what you do with your Toxic Tuesday. I I was the one I told Dawn, I was like, have you seen this? And she goes, no. And I said, you need to go follow him. He's wonderful.
Oh, thank
Yeah.
you so much.
So now you just encouraged me today. I'm going to talk to the board about having a project where we call it a mummy mouth project, where you follow a case on a patient where you've removed a root canal tooth and look at blood work and see if an ANA becomes negative afterwards.
Right.
Follow this patient and see how their health improves.
Absolutely. Awesome.
So thank you. You've been a great inspiration. I'm going to turn the recording off.
Thank you so much, Kelly. I appreciate it. All right, bye-bye.